Hello, my name is Jasmine Poetry, and I am a board certified behavior analyst. This presentation, Understanding Problem Behaviors, is brought to you through a collaborative effort between the Center for Autism and Neurodevelopmental Disorders at UCI and the Thompson Autism Center at Chalk Children's. Autism and problem behaviors. When we say problem behavior, what do we mean? These are behaviors individuals engage in that are inappropriate. The behaviors may endanger oneself or others. For example, hitting oneself, aggressing toward others, running away from caregivers. They may be disruptive, such as throwing things, crying, screaming, or the behavior may otherwise negatively impact the quality of one's life. Children with autism spectrum disorder may engage in problem behavior as a result of many different things. The first is challenges with communication. When children are engaging in a behavior, they are usually trying to communicate something. And if they haven't learned the appropriate way to ask for what they want, they will communicate their needs in maladaptive ways. For example, a child who has not learned how to appropriately ask for their favorite toy may have learned that if they cry and scream, they will receive it. We also see that children with autism may have challenges with transitions or changes in routine. With this, they may have learned that engaging in problem behavior may prevent or delay a transition or change in routine. For example, a child may have learned that crying when asked to transition to bedtime may buy them extra time staying awake, getting to play with toys, or getting attention from caregivers. Children with autism also often demonstrate rigid or inflexible behavior. For example, they may have a specific way of playing with a toy and demonstrate challenging behavior when asked to play a different way. They may also focus too much on a few things. For instance, they may have a limited set of interests they want to speak about, and changes in conversation to neutral or non-preferred topics may trigger challenging behavior. Next, children with autism often demonstrate challenges with processing their environment. For instance, they may have sensitivity to sounds, lights, or textures, which may cause discomfort and in turn lead to challenging behavior. Other examples include anxiety about many different things, trouble with keeping organized, challenges with focusing and attending to tasks, and appearing hyperactive or tired. One or more of these things can set the occasion for problem or unwanted behavior to occur. First, let's define behavior. Behavior is anything that we can observe that results in a measurable change in the environment around us. Simply put, it is anything a person says or does. Note that behavior can also include things we are not able to see, such as feelings, emotions, and thinking, otherwise known as covert behaviors. But for the purpose of this presentation, we're going to focus on the ones that are observable, otherwise known as overt behaviors. Now, in order to change a behavior, we must first define some aspects of the behavior. For instance, what does the behavior look like? Here, we want to be as specific as possible. For example, instead of saying a child engages in aggression, we may say that the child kicks others and that this behavior looks like the child's foot making contact with another person's body. Next, when does the behavior happen? Narrowing down specific times might give us helpful information. For example, does the child usually aggress in the afternoons during homework time or towards one specific person? This information might be helpful. Third, how often does the behavior occur? Does it happen once a day, once an hour, more? Again, be as specific as you can. Next, what do we want the behavior to look like? For example, we may want a child to use their words to ask for what they want or engage in a coping skill, such as taking deep breaths when they're upset. Finally, when do we want the behavior to happen? Or how often do we want it to happen? Some behaviors are only inappropriate if they occur too often or at inappropriate times. Take, for instance, a child who's crying. It may be inappropriate when the crying begins to happen too frequently or for too long. Now that we have defined behavior and what aspects of it to consider, let's discuss applied behavior analysis, which is the lens that this presentation will be presented in. According to Cooper, Heron, and Heward, applied behavior analysis, or ABA, is the science in which tactics derived from the principles of behavior are systematically applied to improve socially significant behavior, and experimentation is used to identify variables responsible for behavior change. In other words, ABA is a scientific practice that encompasses many specific interventions based on principles of behaviorism. Specifically, it uses the principles of learning, such as motivation and reinforcement, to increase desired behaviors or decrease undesired behaviors. In ABA, we assume that behavior is lawful. In other words, behavior is caused and controlled by factors that occur in the environment. As much as behavior may sometimes seemingly occur randomly or out of the blue, ABA asserts that there are past or current environmental events that are causing it to occur. And when we can determine what causes a behavior to occur, we can implement the appropriate strategies to change it. ABA is not just one thing. There are numerous interventions based on the principles of ABA, including but not limited to pivotal response training, shaping and chaining, prompting, discrete trial training, and many more. There are many applications of ABA outside of autism and developmental disorders, but for the purpose of this presentation, we will focus on ABA as it is related to understanding and changing challenging behaviors. So, how exactly is ABA used? The principles of ABA are used to make positive changes to behavior. This is done by teaching an individual new skills, such as communication or tolerance, thereby increasing appropriate behavior and decreasing inappropriate behavior. The ultimate goal in ABA is to enhance an individual's quality of life and promote their autonomy or independence. In ABA, when we are analyzing a behavior, we look at the environmental factors that surround it. This analysis is called a three-term contingency, or the ABCs of behavior. First is the A, or antecedent, and by this we mean what happens immediately before a behavior occurs. For example, did you take away your child's toy? Did you instruct them to do something they may not like, such as cleaning or homework? Next, we have the B, or behavior. Remember that this is anything that is observable. Note, however, that it does not include reflexes such as coughing or sneezing. Third, we have the C in ABC, or the consequence. And by this we mean what happens immediately after a behavior occurs. Note here that when we say consequence, this could be a positive or negative consequence. For example, if your child cried after you told them to clean, did you reprimand them? Did you give them a break? What happened immediately following the behavior? Finally, take into account any setting events or other conditions that may impact someone's behavior at a given time, such as being tired, hungry, starting or stopping medication, etc. When we analyze all these variables, we can enact behavior change by changing part of the ABC chain. Now that we have looked at the ABCs of behavior, let's talk about the functions of behavior. When we say functions, we are referring to the motivation or purpose behind the behavior. In other words, why is the behavior occurring, or what is it trying to communicate? Remember that behavior is a form of communication. So why does this matter? Why do we want to know the function of a behavior? Well, when we know the function, we can teach appropriate ways of meeting it and can ensure that the way we address it is specific to the function. Functions of behavior are classified under two umbrellas. One is to obtain something you want. This can be someone's attention, such as an adult or peer, tangibles, or in other words, preferred toys, food, or other items, and sensory stimulation, otherwise known as automatic reinforcement, which means engaging in the behavior in and of itself feels good. So, for example, rocking back and forth. The other category for potential functions is to escape or avoid something that is non-preferred. This can be a situation or task, such as doing homework, making the bed, or escape from sensory stimulation. So this is another automatically maintained behavior, and it means that the behavior is alleviating an aversive sensory experience. So for example, think about skin scratching to reduce itching. In ABA, board certified behavior analysts, or BCBAs, analyze functions of behavior by conducting various assessments. These include indirect assessments, which may involve interviewing caregivers about the challenging behavior, descriptive assessments, which involves directly observing the behavior, and conducting a functional analysis, which involves systematically manipulating variables in the environment to determine the cause of the behavior. If your child is engaging in problem behavior, particularly if it is severe, such as aggression, destructive behavior, or self-injury, it should be assessed by a BCBA so that a function-based treatment plan can be developed and implemented. Once a BCBA creates a treatment plan to decrease inappropriate behaviors and teach appropriate replacement skills, behavior therapists implement this plan with your child. However, the key to success is caregiver involvement and generalization. By generalization, I mean that when your child learns new skills, they are able to demonstrate them outside of therapy with multiple people, such as parents, grandparents, teachers, peers, and in multiple settings, such as at home, at school, and in the community. If your child receives or will be receiving therapy, it is only for a fraction of the day. That's why it's so important for caregivers to learn the strategies that are implemented during these sessions so that teaching can occur throughout the day. Remember, you are your child's #1 advocate. Now, let's take a minute to reflect on some of your own child's problem behaviors. Remember, behavior is anything your child does or says. Think about any behaviors that they may engage in that are either harmful to themselves or others, disruptive, occur too frequently, do not occur frequently enough, or otherwise negatively impact their quality of life. Be as specific as possible. For example, if your child engages in self-stimulating behaviors, you might define that more specifically as humming. If they engage in meltdowns, you might define that more specifically as crying. Social withdrawal may be defined as not approaching others or hiding. Perseverative behaviors might be defined as repeating words. Oppositional behavior may look like constantly ignoring directions or vocally protesting, so saying no when asked to do something. Aggressive behaviors may look like hitting others, and eloping or running away may look like your child going to see something without asking for permission first. These are all examples of problem behaviors and more specific ways you can define them. I will allow you some time to reflect on your child's problem behavior and think about how you can define them specifically. Now that you've defined your child's problem behavior, let's analyze a few things. First, what happens to trigger their behavior? Remember, this is called the antecedent. And what is the purpose or function of the behavior? What do you do after the behavior occurs? How do you respond to it? Once we can identify that, we can begin to make a change. Now, I want you to think back to the reflection you had moments ago regarding your child's problem behavior. This time, I want you to actually write down the behavior and define it as specifically as you can. And I want you to write down the typical antecedent, or what usually happens right before the behavior occurs. In other words, the thing that may trigger the behavior. I will once again allow you a few moments to complete this exercise before proceeding. Now that we have written down the antecedent and behavior, let's reflect on what consequence you usually provide for the behavior you have identified. Remember, when I say consequence, this does not mean a bad consequence. It simply means what immediately happens following a behavior. When we are analyzing an ABC relationship, the consequence is the most important part because what we do immediately following a behavior is what determines if the behavior will increase or decrease in the future. Let's look at an example. You are at the grocery store with your child and it is time to leave. They want a toy and begin to scream. What do you do? Do you buy the toy to calm them down? Do you leave the store without buying it? How do you respond? As you're thinking about the consequence you usually provide in your specific scenario for your own child and their specific problem behavior, I want you to think about the functions of behavior we previously talked about. In ABA, there are 4 functions of behavior, and I want to look at them again in more depth. So the first function is to escape or avoid something you don't want to do. For example, going to bed, brushing teeth, cleaning are all typical examples of things children may want to escape or avoid doing. The next function is automatic or sensory. This means that the behavior is not due to any social consequences, but rather the behavior in and of itself either feels good to engage in, for example, flapping hands, biting nails, or the behavior removes an unpleasant feeling, for example, scratching an itch, biting to soothe a toothache. The third function is access. This simply means getting something you want. It can be access to a toy, food, activity, or privilege. And finally, we have attention. Keep in mind again that this includes all kinds of attention, whether it be positive attention like words of comfort, hugs, kisses, or negative attention like reprimands or even stern looks. For example, a child may upset their sibling on purpose because they enjoy the attention they receive when the sibling gets mad, tells them to stop, or when caregivers reprimand them. One easy way to remember the 4 functions of behavior is to remember the acronym SEAT, which stands for sensory, escape, attention, and tangibles. Note that a single behavior can have multiple functions. For example, crying can occur for attention and escape based on the context, and that functions can also change over time. Now that we have discussed consequences, also known as possible functions, let's revisit the example you wrote down of your child's problem behavior. So earlier we defined the behavior specifically, as well as indicated the antecedent, or what happens immediately before the behavior. And now I want you to take a minute and consider the consequence. In other words, how do you typically respond immediately after your child engages in the behavior? I will give you a minute to write this down before we move to the next slide. Now that you have learned how to define a specific behavior and describe what happens immediately before as well as immediately after, one way to determine what the potential function of the behavior is, in other words, why the behavior keeps occurring, is to track it and look for recurring patterns. You can use a form similar to the one here to keep track each day. In the first column, you will indicate the problem behavior. In the second column, you would indicate the time of day that the behavior occurred. Next, you would note the setting or location where the behavior occurred. And these two things are important because we may discover specific times of the day or settings that the behavior occurs in, and the more information we can have, the better. Next, you're going to indicate what happened immediately before the behavior and what did you do immediately after. After that, you're going to indicate what the possible function or purpose of the behavior might be. And lastly, you are going to know what you want your child to do instead of engaging in that behavior. Here's a sample of what your form may look like when you begin to complete it. So in the first row, it was noted that problem behavior, crying, occurred at 9 a.m. in the kitchen. What happened before was that the child saw milk on the counter and they couldn't reach it. So what did caregiver do after? They gave milk after the child cried. And the possible function or purpose of this behavior was most likely to for tangible or to gain access to milk. And what we'd like the child to do instead here is to say milk or I want milk. Note that functional communication may look different for every child. So some children may communicate using vocal language, while others may communicate non-vocally using sign language, PECS or picture exchange communication system, or any augmentative and alternative communication device, also known as an AAC device. Now, in the second row, we noticed that crying happened once again, this time at 3 p.m. in the bedroom. What happened immediately before was the iPad was taken away, and immediately after, the iPad was given back. Possible function here is once again tangible, access to a tangible item, aka the iPad. And here, what we'd like the child to do instead is to say more time, or for them to maybe tolerate having the iPad taken away and to choose a different activity instead. It is important to note here that while you can track these behaviors at home and determine potential functions, it is best to have them assessed by a board certified behavior analyst who can conduct thorough assessments, such as a functional analysis to determine what the function of a given behavior is and create a function-based treatment plan. So far, we have talked about how to identify and define behavior, how to identify environmental factors that can influence behavior, such as the antecedent and consequence, and how to determine the potential function or functions of behavior. Next, we will be discussing one way to make behavior changes using rewards. Let's look at an example. Let's say your child does not like to do homework. The behavior you want them to engage in is completing their homework, and thus a strategy you can use to make a behavior change is reinforcing or rewarding homework completion. What do we mean when we say reinforce? Well, reinforcement is like a reward. By rewarding a behavior, it increases the chance that the behavior will occur again in the future. Let's look at that example again. If a child needs to do homework but does not like to do it, the next time it is time to do homework, deliver the instruction in a first-then format. To do this, you will have to identify an item or activity your child really likes and make access to it contingent on following your instruction. For example, you might say first homework, then iPad. After you deliver the first-then instruction, you will withhold and only deliver it after the homework is completed. It is important to do this immediately because rewarding behavior is most effective when it is done immediately following the behavior. As a side note, make sure that the homework is something your child already knows how to do. And if they don't know how to do any part of it, they will need to be taught the necessary skills first before you implement this strategy. Alternatively, you can teach your child to request for help if they don't understand something in their assignment. And another important thing to consider is that the homework you present is the amount of it is not too much. So for example, if there's a packet of homework, you may only want to present one page at a time. This is just one example of many. And again, for a more individualized plan, you will have to consult with a behavior analyst. Another important note about rewards is that the most difficult behaviors should have the most favorite rewards. By this, I mean that more aversive or non-preferred a task is to engage in for your child, the higher the kind or amount of reward should be. Rewards can be anything from access to electronics, activities, preferred snacks, attention, access to toys, and any other thing you can identify that your child likes. Now let's take a moment to apply this to your child. What are their favorite things? I want you to rank them from 1 to 5, starting with what is most highest preferred. You may base this information on what your child reports or from what you've observed them engage in when they have free access to anything they'd like at home. I'll allow you a minute to complete this exercise before moving on to the next slide. Now that we have reflected on your child's most favorite things, let's rank the order of rewards and connect them to the most difficult behavior for your child to engage in. Remember to choose practical rewards that can be delivered right away. Let's look at some examples. First, if iPad is your child's most preferred reward and doing homework is the most difficult behavior for them to engage in, you may want to save iPad as a reward for completing homework and restrict it during all other times. If cookies are their second most preferred reward and making their bed is the second most difficult behavior for them to engage in, you may again want to reward making bed with a small piece of cookie. Finally, if playing outside is the third most preferred reward and playing nicely with sister is the third most difficult behavior for your child to engage in, you may want to reward playing nicely with sister with access to going outside. Note that in that last example, you will have to be more specific when you instruct your child to play nicely with their sibling. What does that look like? For example, you might say something like, play with hands to yourself or have a calm body to let your child know the behaviors that you want them to engage in. Let's go back to our last assignment. You've already ranked the order of rewards for your child. And now I'd like you to take a moment to also rank the most difficult behaviors for them to engage in from most to least difficult. I will allow a moment for you to reflect on this and complete the assignment before moving to the next slide. Once you have your rank order of rewards and difficult behaviors or tasks for your child to engage in, you can keep track of it using a visual like the one here. In this example, we have a calendar on which we are noting if certain behaviors occurred each day, such as doing homework, making the bed, and if rewards were delivered immediately following those behaviors. A chart like this will allow you to see if the rewards are effective in increasing your child's desired behaviors over time, and will also help you keep track of whether you are delivering the rewards contingent on your child engaging in those behaviors. Take a moment to reflect on how you might be able to track this at home. For example, you can use a dry erase board or print and laminate a similar chart to hang on your child's bedroom door. When making a behavior change, consider the following. 1. Does your child have access to everything anytime? If so, you will want to restrict access to rewards and only deliver them when your child engages in a specific behavior. This is to ensure that the motivation for earning the reward is high. For example, if you're using iPad to reward doing homework, but your child has had access to the iPad all day, this may not work as well as a reward because the motivation to earn the iPad may not be high anymore. Also, do not negotiate and do not give in once you have set a limit. This will send mixed messages and potentially increase inappropriate behaviors. Keep in mind that consistency is key. We don't want to start implementing behavior change unless we are ready to follow through with what we have said each and every time. Remember again that visuals such as pictures, schedules, and even timers can help children understand what we're asking them to do or to help signal the beginning or end of an activity. Here are some additional examples of visuals you can use at home. For example, you may use a bedtime checklist like the one on the right side here on your screen to help your child visualize and anticipate the steps for getting ready for bed. You can help them with any steps that are difficult for them to complete and even reward the completion of each step, especially when the child completes steps independently and in the absence of any problem or challenging behavior. Some final things to keep in mind as you begin to implement some of these strategies. The first is what is called an extinction burst in behavior analysis. So, an extinction burst is something that may occur when you first stop allowing problem behavior to gain access to a preferred or to a previous reward or preferred consequence. So, for example, if your child used to engage in tantrums to get access to a preferred item, attention, or break from a non preferred activity, and now you're not giving them those things anymore and you're teaching them an appropriate way and only rewarding those appropriate behaviors, the tantrums may get longer in intensity or duration as your child tests boundaries. So, in other words, the behavior may get worse before it gets better, but don't quit yet. Remember that setting limits and being consistent is key. In fact, setting limits with your child is an act of love. It's okay to be kind but firm at the same time. Set your limits and keep in mind that while it's okay to negotiate before you instruct your child to do something, do not negotiate if problem behavior occurs. Also, don't be too sympathetic and don't give in just this once. Otherwise, your child may try twice as hard next time to engage in inappropriate behaviors to get what they want. And this concludes our presentation. I hope that you found the content to be helpful and empowering. Please feel free to browse this list of resources here for additional information on managing your child's challenging behavior and other related topics. Thank you so much for tuning in. Please note again that the content we discussed today included general strategies for identifying possible functions of problem behavior and some general information on identifying and delivering rewards. But this presentation is not meant to be a substitute for therapy. So again, it's best to consult with a board certified behavior analyst to conduct those formal assessments and create individualized treatment plans tailored to your child's unique needs. And if you have any questions, please feel free to reach out to the Center for Autism and Neurodevelopmental Disorders at UCI or the Thompson Autism Center at Chalk Children's. Thanks so much.